Welcome, everyone. I'm Dr. Liana Lianoff. I'm the president and founder of the Global Positive Health Institute, and this is our GPHI podcast series where we examine all the topics related to positive health, positive psychology, health, and well-being. And today, I'm delighted to have as our guest Dr. Karen Garman. She's a medical educator, a positive psychology coach specializing in working with health professionals, and she recently received the International Positive Psychology Association's Positive Health and Well-Being Award. It's the Practitioner Award for Lifetime Achievement in Positive Health and Well-Being. That's a mouthful. Welcome, Karen.
Thank you. That is a mouthful. Thank you for working so hard to try and introduce me that way. Yep, that's 18 years worth of work, so it adds up.
And we really appreciate you. So tell us what got you started in this field.
Well, it really was 18 years ago. I was doing positive, I was actually doing public health work here in Southern California right after 9/11. And if you recall back then, the terrorist actually came across the border here in San Diego, trained in a community college on how to fly a plane, and then ultimately, did their incredibly dangerous and horrific crimes. And so San Diego was very upset that they had not been more proactive. And so part of that was they wanted to make sure everyone in public health understood the ramifications of terrorism and all the horrible things that can actually happen to us. I think previous to that, we all kind of lived in a bubble, and those, 9/11 really just kind of woke us up to all that. So I was actually working with them as my medical education hat. Trying to build a training program to get public health people aware of the fact that when things went really wrong, they had to come to work, when everybody else had to stay home. And certainly now we say that after post-COVID, and it seems like a no-brainer, but back in 2001, it was a brand new concept. The training programs that were available were all run by the military. And so it was incredibly negative, fearful stuff. And if you've ever been involved with public health people, you find out that they are incredibly positive people. They are the advocates for the folks that nobody else actually cares about in healthcare. They're the most positive people that I know in this business. And so when they started to do these military trainings and they were bringing in military people to train them about all the things that could possibly go wrong, it literally scared them to death, and they never, the word got out and they never showed up. And so the question was, how can we get positive people to learn about difficult things? And I started to search on positive learning, and came across Marty Seligman, who, if you imagine, at that time was just coming out with positive psychology. And back in those days, you could just email Marty and he would write you back. And I got talking to him about what it was in terms of making healthcare people more positive about the work that they did. And so he gave me a lot of insight into things, including he was just finishing his book on authentic happiness. We talked a lot about subjective well-being and Ed Diener's work. And I built all that into a program. And so we started a public health training here in Southern California that we called WRAP, which was actually Workforce Readiness and Preparedness, which was considered kind of innovative because everybody was talking about all the things that could go wrong, and we were talking about all the things you could do to be prepared. And it took me 6 months to convince the public health people to offer a public positive course on what it was to be a professional in healthcare. When we finally offered it, we had standing room only. We had waiting lists because people so wanted to respond in positive ways. And they were looking for somebody who was actually going to talk about what they could do in a positive way versus all that could happen in a negative way. And so that's when I realized the power of positivity in healthcare. And so kind of took off from there. So that was in 2003. And then Marty offered the master's program in 2005. And so I got to be part of the first class as a result of my relationship with him. He invited me to apply, and I couldn't imagine a better program to learn from the best and the brightest in terms of all the researchers that were just getting off the ground. Barbara Fredrickson presented her Broaden and Build paper off of her typewriter. She Xeroxed it when she presented it. It wasn't even published yet. I mean, it really was the beginning of the whole science. And so I was thrilled to be part of all that as part of the first class. And so that's kind of how it all got started back in 2005.
Exciting times. So we'll share then a little more from that big bang early on, where you got in with some very special people, including Marty Seligman, how things evolved for you in your career and professionally, how you've used this.
Yeah, I mean, I really have been very fortunate, to have people like Marty. Chris Peterson was my chair for my capstone for MAP. So, he was one of my mentors. Ed Diener was there. I mean, it really was kind of the who's who as they paraded through, once a month as we did this program. People really thought I was crazy to get on a plane and fly to Philadelphia once a month to do this program for what is actually my 5th college degree. So it wasn't like I needed the degree. It was strictly because I wanted to be in the room with these people. And I often said to people, well, I really don't know what I'm doing right now, but someday I'm going to look really, really smart. And so I kind of used that line when they I got the award at IPA, because it really took 18 years to look really, really smart, to talk about positive health and well-being back in 2006, 7, and 8. Well-being actually in healthcare, the well-being committee was the committee that actually founded people who were, impaired. So impaired physicians were reported to the well-being committee. So you didn't want people in the well-being committee to know your name, because that really meant you were in big trouble. Well-being was actually a negative word. Positive health was a negative word. I mean, these were concepts that really had negativity bias all through the profession. So to be able to try and build these concepts without saying them in a sentence was a real challenge in the beginning. We didn't know how it would stick. It really was kind of tough. But my capstone was actually, I took Barbara Fredrickson's Broaden and Build concepts and did it with medical students at the University of California, San Diego. We did it with the whole 3rd-year class. We trained the physicians on how to give positive feedback, which to them blew their mind, that they actually got to tell the students what they did right versus what they did wrong. That took several hours of faculty development. But we finally convinced them to do these sessions where the students worked with standardized patients, which were people trained to be sick. There were well people who were trained to be sick. And the students then were asked what they did right when they watched their videotapes. And the faculty were to reinforce the good behaviors instead of the negative behaviors of these 3rd-year medical students, which you can imagine they do a lot of things wrong because they're very young in their career. We actually recorded the sessions where the physicians were, as their coaches, as their faculty, were told to say positive things. And the irony of it was they couldn't do it. We had about 16 faculty small groups, faculty-led small groups, and about 7 of them did it, and the rest of them just reverted back to their behaviors of seeing things that just made them crazy. And so what I did was, because it didn't work in the original format, was I took the tapes of the faculty coaching the students and did Broaden and Build, where I literally just counted the number of times they said something positive versus the number of times they said something negative. But then we had, as part of the curriculum, the students were actually given a performance exam. And we were able to look at the scores of the students. And to everyone's surprise, the students that got more positive feedback performed better in the exam than the students who had gotten more negative feedback. And so when I presented this to the faculty, to the chair of the Department of Family Medicine, he pounded the table and said, "But Karen, you mean to tell me that the way I talk to my students affects their learning?" And I couldn't believe he said that. And so I made him repeat it, which only made him more angry. And then when he finally got it, it was this aha moment that it just never occurred to healthcare professionals that their words had power, that the way that they present and think has power. And so having had an undergrad degree in communications, I realized that it was the power of positive emotions and positive words that was really the start of where I needed to be in healthcare. And so that's really where I've been working and concentrating ever since, and have done it now for Kaiser Permanente. I've done it for Sharp and Scripps here in Southern California. And so, yeah, over 18 years, it kind of added up, but I'm still doing it. I'm still doing it today for Rady Children's Hospital here in San Diego, because there's an entire generation of professionals whose entire curriculum when they're trained is around what's broke, disease, and doesn't work. And that's the only thing that they're supposed to look for. That's the only thing they're supposed to talk about. And that's the only thing that they're supposed to concentrate on. And so negativity bias serves them very well in their profession. And so they're very successful by looking at and finding out what's broke, disease, and doesn't work. But what we're finding now is it really affects their well-being. It affects their professionalism. It affects, they can't do it in this environment and continue to be healthy professionals. And so what we're really learning now is that we're doing more around professional development and the whole idea of teaching them about their strengths and teaching them about positive thinking, that they just never had that door opened. And they're bright, intelligent people. So when you do it, you can see the light bulb go on over their head. It's magic. It really is beautiful magic, but you really have to convince them to open that door. And that's the piece that's probably the hardest, is getting them to really take that chance.
Yeah. Well, you were involved in the early days when, as you described, it was such a foreign concept, and it still is, of course, in many parts of healthcare, to be talking this way, these constructs of positive psychology and positive health, but things are shifting a bit.
Yes,
and well-being and positive health are, I think, more positive words. And a lot of the programs that are offered in academic healthcare institutions and elsewhere are ones that individuals now gravitate to because they know they're not being singled out as having bad behaviors or alcohol misuse or whatever it is, although those people still need that attention as well. But really, it comes down to that all of us, in society, and then particularly in healthcare settings, healthcare workers need that kind of positive health support to really engage that broaden and build theory, to engage our brains in ways that we can be effective with our patients and our colleagues. And so it's starting to really take off. And so thank you for your early work in this. And of course, we were talking earlier that we have a long ways to go.
Yes.
And that's where the GPHI comes in. We're trying to nudge healthcare in this direction and transform healthcare for the professionals themselves, as well as how they talk to patients, et cetera. So what might be your proudest moment or the biggest achievement over those 18 years?
It's been such an accumulation over time. And so I guess the thing was when everything kind of all came together, what I was working for Kaiser Permanente, and Kaiser Permanente decided to start their own medical school, which was unheard of. I mean, medical schools, academic medicine was always seen as being part of the university structure in this country. It's not the case in other parts of the world, but certainly here. And Kaiser Permanente being a private healthcare system, the idea of building their own medical school would not have in any way, shape, or form been allowed up until 2010. And so what happened was I was there at the time. And so preaching this as I was to graduate medical education and to residency directors, to get residents to understand the importance of positive emotions and well-being and positive health. They asked me to be part of the design for the curriculum. And so what transpired was they create that in Kaiser, they call it reach. And it actually is time in the curriculum where the whole curriculum stops and the students just learn about positive health and well-being. And they take the time 1 week, about every 13 weeks throughout 4 years. So you add it up and it gets to be much more than even a course would be in many academic environments. But the medical students are really given the insights and all the training and all the knowledge that we now have. We didn't have it, when I first started. We now have such a wealth of literature that we can share with these students. And so I am so hopeful that that generation, which is just coming out now, the school started, the first class is going to graduate. And it's going to be that generation who's really going to take this and really care about it. Because when you talk to the work that I do at Rady Children's, we do a lot with nursing new grads that are just coming out of nursing school. The Gen Zs of the world, they get this, they know, and they understand it. So it's not the hard sell that I had back in 2005, 6, and 7. Now it really is, what can we do now to make sure that we don't become this burned out, crust of a professional 10, 15 years into our career, because all that addiction that we did see in the well-being committees back then was just the outcome of people who were burned out and really despondent. And, we have to so treat, as we know in health, you so have to treat the root of the problem and not just the symptom. And so it really has become, now we realize the root is right in the training. And so I'm just so pleased that Kaiser gets to be that kind of role model for that generation. And I think many other medical schools are probably following suit. So there's hope. They're around the corner.
Yes.
They're going to convince everybody else. So it's just going to take time for that to kind of gel. But it had to be built on a body of evidence. You just don't walk into healthcare and say, I got a great idea. It just doesn't work that way. And that was the reason for getting the degree back at Penn. And, when I did, because if I didn't have the pedigree, nobody was going to listen to the ideas. We're too evidence-based. But we do have the evidence now. I mean, your work, all of this is now accumulated, that we have the body of work now to be able to show these folks to adapt and adopt.
Yes. And that's what's so exciting and excited me, that there is this body of work. A lot of it, though, is in the social sciences, positive psychology sciences. And so we're trying to get it translated to more traditional primary and specialty medical care. And so your work is doing that. GPHI is doing that. And then hopefully we can actually build that evidence within those systems and do more translational research right there in our primary care clinics and show that outcomes can be impacted.
Yeah, and I always said, I was, I introduced myself as a positive psychology coach, but technically, it was many degrees that got me here, because it was it's always the positive psychology science, but there's also, I believe, the implementation science.
Yeah.
Positive psychology was great about all these wonderful ideas, but they didn't know how to implement it. I mean, that's actually why Marty started the MAP program to begin with. He didn't know how to make it stick. That first class, we were kind of like Noah's Ark. There were like 2 from Google and 2 from law and 2 from health. He basically took us by twos, and he was hoping that somebody would take it and make it stick. So I always say that, my background was the trifecta of basically positive psychology, implementation science. I actually have a degree in human performance technology. So, how do you make people, actually change performance? And then the third piece is certainly the medical education piece, which includes a lot of, and the neuroscience stuff. I mean, I was one of the first to use heart math to really look at the whole idea of heart rate variability has a lot to do with how your brain fires. That the fact that we're not just walking brains, that we do have a lot of we have a whole neurosystem that, senses a lot of stuff, and all of that becomes part of who we are. And so certainly when I coach older professionals who are much more set in their ways, it's the neuroscience stuff that really is my ability to get them to unplug that synapse over here and plug it in over there, because that's painful for them. And, knowing and understanding that kind of, body experience of change is an important part kind of going forward. So that's why I say it's not just one thing. And, in healthcare, we were so used to the science just being cardiology or dermatology, or, we had all these little sub sciences, but now we really have to blend the sciences. And that's why I say it's a whole new way of thinking, and how medical education is kind of taking that now and running with it.
Yeah, absolutely. And I love what you're saying about blending the sciences, because that's the front and center, what we're doing with person-centric medicine. That's
Yes,
a word, whole
absolutely.
health. We're combining all of that, plus on the foundation, I think, is the foundation of what we're calling positive health. Or none of that will stick without addressing, ultimately moving people from the diseases of despair, stress, trauma, etc., to becoming their best selves and continuing on that journey. And then all the other treatments, if you will, build on that.
Yeah, and that's why I kind of applaud Kaiser, because they were an early adopter, because, the Kaiser model was, if we keep you healthy, we make money. In every other healthcare system, they make money when you get sick. Yeah. So why fix the disease if you're not, if it's going to put them out of business?
That's right.
And so when healthcare became a business model, which I'm sorry to say was under my tenure, it really did kind of change the whole kind of approach to why are we fixing these systems in the first place. And Kaiser got it. Kaiser's system was, no, you keep you healthy, and then we don't have to spend the money, and then we can invest in other things like a medical school. And so that's actually what happened. They got so good at it, they had extra money, and they didn't want to lose their nonprofit status, so they built a medical school to invest back into the community, and that was their way of doing it. Where a lot of other healthcare systems are all about the bottom line and whether they're going to be in the red or the black, because they're spending so much money because people are so sick.
Yeah.
It's a mindset that had to really flip. And that's why I say the negativity bias was that actually they were making money by people being sick. The system thrived when people were sick. And so, it was really hard to get people not to be thinking, and when you get into, the whole growth mindset thing, and fixed mindset, I said, fixed mindset works very well in healthcare. Fixed mindset means everybody does the same thing over and over again, and we got standardization. So you don't want people to be creative and do growth mindset. And so, you deliberately pick a type of personality, a type of learner who succeeds in healthcare is a very fixed mindset, negative bias. These are the people who succeed to the highest levels of healthcare. So how do you come in and say, well, no, it's about growth mindset and positivity? And, it kind of blew their brains.
Yes, absolutely. I've experienced that myself. People looking at you going, no, what are you talking about? This doesn't even belong in medicine, but we're shaking things up.
Right.
So the listeners out there are interested. I think that's why they're following what GPHI is doing. I think are wanting to shake things up. A lot of them are in the lifestyle medicine community, and that's shaking things up. That we can do so much for all the chronic diseases with the basic healthy behaviors. And then now in positive health, we're adding the field of positive psychology sciences and biopsychosocial model. And so what advice do you have for our listeners about how to get into this or make the most of this science that's now there and burgeoning?
So what I often say to people is, healthcare is a very complex system, and it's a very complex problem at this point. And it's kind of like a Rubik's Cube. You can fix all the sides and get one side real pretty, but the other stuff's still messed up. And so you don't have success. And so the hardest part about a Rubik's Cube is knowing when to pivot, where, and as you kind of figure this out. So I say to people, in healthcare, it's the same way. You have the big system, like we're talking about, like a Kaiser, and then you have kind of the, which we call the extrapersonal, and then we have kind of the interpersonal, which is the communication piece, like you're talking about, and the groups and the communities that are thriving, and then you have the individual. And so in all the years of medical education, we were always working at the big picture, the global piece. And we would get that one side real pretty, but then we wouldn't have the interrelational, and we wouldn't have the intrapersonal, and we wouldn't have the, and we didn't care about that. And so, well-being was when that piece broke down, and we would literally throw them out the system. We would just pull them out and throw them out. Well, we can't throw people away anymore. We don't have enough people in healthcare to throw them away.
Yeah.
And so it has morphed the model, and the model now starts here. Then you work with this, and then you build that. And so there are a lot of people who are running into healthcare thinking they're going to fix that. Well, that is the old model. The new model is you have to do it individually, which is why I now do so much more in coaching than I do anything else. Then you have to build the relationship. You have to build the local model, within the units. Then you have to build the system, and then you build the bigger picture. Mm-hmm. And so I tell people that it is a long-term investment because it's smaller steps. When you built the big system, you could point at something and you were real proud of it. But, even bricks and mortar, it still has to be, you can build all the fanciest buildings and beautiful campuses and all that kind of stuff that healthcare did for the last 50 years, but you still got to put people in the buildings. Mm-hmm. And so we have to become much more focused now here. Mm-hmm. And so with all that we know now about positive psychology and what we can do in terms of positive emotions and working from our strengths, and it really does kind of start here, and then we build that community around us. So everybody in healthcare has the ability to affect the system, because everybody has their own center of control. Everybody has influence. We all work with colleagues. We all work within systems. We all have the absolute empowerment to start well-being here and then share it with others. And then the interesting thing about healthcare is the tipping point's not that high. You say, oh, it has to be like 50%. Not really. What we find is most changes in healthcare happen at like 20%. Mm-hmm. So if you can get 20% of your department or 20% of your school or 20% to really start to believe in this, and we've seen it in education, it really does tip pretty quickly. And so what I tell people is don't get sucked into trying to change the world. Get sucked into changing yourself first, and then changing somebody in your circle tomorrow, and then just kind of go from there. And it really is much more rewarding as a practitioner because you really can see your impact. But it also is much more of, talk about meaning and purpose, which is a big part of the world these days. It has a lot more meaning and purpose than trying to change the system.
Yeah, very satisfying.
Yeah.
So well said, well said. So as we start to wrap up, and what are some resources that you recommend to our listeners? What are your favorite resources on this big topic?
Oh boy, yeah. Like I said, I kind of pull from all over the place because I'm quite, I'm looking at different blends. Certainly the greater good folks at Berkeley, they have, I'm always looking for places that I can find quick articles, pull things to show people, again, because that's kind of my currency. I can't convince healthcare folks unless I show them the science. So Greater Good's a great place.
Greater Good Science Center, yes.
Yeah, Science Center.
Usually top of my list as well.
Yeah, I mean, you can just find about anything in terms of starting there to give somebody some general, especially for general principles, like the foundations that you mentioned before, that foundational stuff, they've done a nice job of building that kind of going forward. I'm a real big believer in HeartMath and their ability to look at the whole nervous system and how that affects how people learn and think and act. And so I believe in their practice. They've kind of taken that to a very nice level in terms of changing behaviors and stuff. And so I do a lot of coaching work with people in terms of working on their nervous system to start to look at their, and so I use HeartMath a lot. And then for the implementation science stuff, it's actually ISPI, the International Society of Training and Development, Training and Improvement. And they look at how people change. And so a lot of that human-centric stuff comes out of their work. And so their model is the HPT model of human performance technology, where they really do kind of see it as a science on why people will change their performance. And For a lot of these programs and stuff, people, when I do my coaching, I actually do it on a retainer. And the retainer idea is it's a return on investment. And that came out of all of that work with HPT, because they do look on the return on investment for changing performance. And so they give you the ability to show that. And so I learned very quickly how to measure performance changes so that I could show that the investment in bringing me into the organization actually has a rate of return, usually 3 to 4 times of what they're paying me. It's just how you have to kind of show that where those numbers are. It's not in a revenue generation column on your Excel spreadsheets and other areas of expenses that go down. So I would say that's kind of my big 3.
Well, thank you. That's useful and a little bit different than some of our other guests, because I don't know that we've talked about implementation science and performance change science. So this is great, adding to the mix, because it is all about that. When it comes down to it, if we're going to transform medicine and healthcare and how it's practiced, then it's about that implementation.
It is. It's about the practice.
Yeah.
I mean, and that's why I say you can build all the theory you want, but until you implement it, it doesn't make an impact. And so that was always the case, and why I so appreciated the practitioner award this year, because I was always about making the impact. I wasn't around being the researcher, though I love the research. I would do it if I could, but I really wanted to try and make the impact. And for me, making a difference every day is my meaning and purpose. And so, it really was important for me to be able to kind of build that into my consulting and my coaching as I kind of move forward. So, it's not as big and flashy as some of this stuff is, but it really does kind of make you get up in the morning.
That sounds like a wonderful way to wrap up, because you're a living example of a living, breathing example of positive health and adding meaning and making a difference in our lives. That eudaimonia that's so important for our physical health, emotional health, and our longevity. So you're going to live a good long life, I hope. And, so we have to conclude this session. Any parting words of wisdom for our listeners?
I do think it's so interesting now to have so many different theories and opinions and research out there. And so there's no one way to do this. These are complex problems. In some cases, people call them wicked problems. These are wicked problems that require complex solutions. And so anything that talks to you that you think is as a starting point, learn it yourself. Try it on for size. If it works for you, then tell 10 people. And that's basically how you have to start this, because I don't think that anybody has the answer anymore. And I don't think there is an answer anymore. And I do think that, one hospital is one hospital. I in all of this work that I've done in healthcare, people say, what's the common theme? And I say, there is none. It really does depend. And we're complex people, and we're all trying very hard to take care of each other when it comes to healthcare. And so it really does, it deserves the respect of having a complex solution. Because otherwise we are just making light of our human beingness, and I don't think that's what any of us want to do in healthcare.
Well, those are terrific words of wisdom to end on. Thank you so much, Garman, for joining us, and thank you to our listeners for following the GPHI podcast series. We hope to see you on another one of these in the near future. Please subscribe to our channel, and until next time, be safe, be well, be happy. Take care, everybody. Bye-bye.